welcome back. We all know this weekend is Halloween, but right after that, another big date, November 1st, open enrollment. I am here with CEO of Enrollment USA, John Carroll.
Yes,
and tell us why November 1st is such a big day for you guys.
And November 1st is the start of open enrollment for the Federal Care Act and health insurance, which is better known as Obamacare. There's an open enrollment period that goes from November 1 to January 31st when you can go online, enroll, and no medical conditions or pre-existing conditions to apply. So you can sign up for any of the plans that are available and see what your options are.
Great, and it's good for people not to procrastinate on this, to get ready for November 1st with the information that they need. And what is that information? What should they be looking out for?
The keys that the people need to look out are things like their doctors, their drugs that they're looking for, the hospitals that they live near and they have relationships with. So it's very important that you match your plan up with what's available out there today.
Great, and how does Enrollment USA work?
Well, Enrollment USA works in a number of different ways. You can either call online, you can make an appointment, come in, you can go to the website and research all the different options that are available. The company was built in the state of Utah just for Utah this year. So all the big major players like the Select Health and the Arches and the Regents and United and Humana, they're all on there. So you really want to make sure that you pick the right plan, and you also want to validate that the plan you bought last year is the best plan for you this year, because about 2 weeks ago, right around October 15th or 10th, hundreds and thousands of letters went out in the state telling everybody what the renewal was for the plan that they currently hold. So it's important that you go there and validate that you have the best plan for you based on the cost. There were a lot of big increases this year, so you want to make sure that there's not a better option for you today.
Great. Okay, and you guys do a lot of really great things, but one of those is you have something for Spanish speakers, Spanish-speaking families here in Utah. What is that?
Yes, we do. We have two divisions of the company. One is Enrollment USA, and the other one is called La Familia. In the Latino community, the culture, families are very important. So La Familia relates to healthcare and the family, and we have a full division of telephone numbers and translations, and making it easy for people that to understand in their culture what they're buying. It's very, very confusing for the general public. It's even confusing for those of us in the business, so it's extra confusing. This is the first time, once Obamacare came into effect, that people, it's mandated, and it's a law now that you buy health care and you are covered. If you don't, you have a substantial penalty. This is the 4th year, so the penalty has gotten big enough that it really makes a difference. So we really want people, when they buy something, understand what they buy and make sure it's the best for them.
It's great, and one of those things that you guys do is a comparison tool.
Yes.
So explain to everybody out there what the comparison tool is.
Well, once you go online or talk to someone, they'll ask for your age, your sex, date of birth, and the doctors and the hospitals that you're with. So the comparison tool will actually show you all the different prices and options from all the different carriers. So it makes sure that if you say, I need this doctor and I only want to go to this hospital, that those are the plans that they're showing you, so you don't want to be surprised after you buy somewhere during the year next year, come up with a medical condition and find out that you can't go to the hospital that's 5 miles down the road. You want to make sure it's a good match.
Yeah, exactly, and keep those relationships with the doctors you know and care about.
Yes.
Okay, how do people get a hold of you guys?
Well, they can either go on enrollmentusa.com, or they can call the 800 number that's on the screen right now, and we're there to help.
Okay, and tell everybody the dates one more time. November 1st to
January 31st, and open enrollment ends on January 31st.
Okay, great. Thank you so much, John.
Thank you so much. Appreciate it.
Okay, we will be right back with more on The Place.